A top South African scientist says there has been a sharp rise in new COVID cases as new variant Omicron spreads across the country. But Dr Michelle Groome says more data is needed before any conclusions can be drawn about how infectious and dangerous this variant is. So far, Omicron has been detected in over 24 countries. It was first identified in Botswana and South Africa, which has now been cut off from air travel by many nations. Here in Europe, the variant has been detected in at least 13 countries, from Norway and Germany in the north to Italy and Portugal in the south. Researchers say they will need 2 or 3 weeks to work out whether Omicron is more transmissible than the now dominant Delta strain, whether it's resistant to vaccines or causes more severe symptoms than previous coronavirus variants. And let's go right to our correspondent, Adrienne Krisch. She is standing by in Johannesburg at a school that is serving as a vaccination center. Hi, Adrienne. The variant was first detected there in South Africa. What more do scientists know about Omicron at this point?
Well, Sumi, as you said, it is still a bit early. We do not have much comprehensive data at that stage, but of course scientists have made some observations already. It looks like that this variant is more infectious than the previous ones, and that also counts for those who are already vaccinated and those who were previously infected with other variants. And that is, of course, a concern here in South Africa, because the country has seen high infection rates before, and scientists here were actually hoping that this would help in this fourth wave to keep numbers low. But it doesn't seem to be the case with the current variant. The only thing that people are currently putting their hopes into is that we are not seeing high hospitalization rates. It doesn't look like this variant causes more severe disease. And so this is something that scientists are saying gives some reason to hope that we will not see such a bad fourth wave here in South Africa.
Adrienne, what are health officials there doing to prevent contagion?
The health minister today said that he is hoping that there are no more stricter lockdown measures necessary, which is an interesting statement because many people here have expected that we will see stronger lockdown measures. The country is currently on the so-called alert level 1, which is the lowest lockdown level. There's still a night curfew, but apart from that, life has been going on as normal here. The authorities are hoping that vaccinations can make the difference, because we've seen early data that the Omicron variant can also, at least it helps against severe disease with the Omicron variant if you are vaccinated before. The problem is the vaccination rates here have been very low. Less than 25% of South Africans have been fully vaccinated. That number is very low, especially considering that vaccines are widely available. That's why we're currently here in front of one of the vaccination centers at the school. They have had a very slow uptake. Today the authorities decided to do door-to-door campaign in the area here, trying to convince people to get the jab. We've talked to some people here. There's a lot of hesitancy here. Many people believe they will actually get sick once they get the jab. So they're trying to convince them otherwise. They're trying to educate them and trying to push them to go to get vaccinated before the fourth wave is even getting worse.
We mentioned that many countries are trying to seal themselves off from the Omicron variant, including with flight bans. What does that mean for South Africa?
It's a total disaster for the South African economy, and it's exactly what we've seen a year ago when South African scientists discovered the beta variant. Back then we saw the same measures. South Africans were not allowed to travel to certain countries. Tourism arrivals broke down here, and it's exactly what we're seeing now again, and it's a disaster for the economy. We already have unemployment rates of about 35%. This is likely to increase in the next months in a country that is having massive poverty and inequality issues. So it's a massive problem, and understandably the president here was quite furious about the announcement by other countries to shut down the borders, because it is a big problem, especially for the tourism sector. The season is just about to start here. Everybody was looking forward to December, finally a tourism season with a lot of tourists coming in again, but this is just not going to happen once again.
DW's Adrienne Krisch reporting there in Johannesburg. Good to talk to you. India has confirmed its first cases of the Omicron coronavirus variant in the southern state of Karnataka. Health officials say the 2 men who tested positive are showing mild symptoms. According to local reports, one of the patients had arrived from South Africa, while the other had no travel history. The news came months after a devastating wave of the coronavirus that killed more than 200,000 people in India. Only about half of the population has been immunized so far. And we can speak to our correspondent standing by in Delhi, DW's Nimisha Jaiswal. Hi, Nimisha. How are authorities reacting to this news?
Well, Sumi, the government here in India has jumped to action. Within a day, it imposed new restrictions as well as testing protocols, especially on travelers coming in from at-risk countries, or testing them at the airport, quarantining any positive cases, and then retesting even the negative cases 7 days later to ensure that the virus is not detected later either. They're also genome sequencing any tests of the people coming in from at-risk countries. And also, India has pushed its decision to reopen all commercial flights in the middle of December. The health minister has said that India has learned a lot from the COVID crisis and has a lot of resources and testing available. And the Prime Minister himself has reiterated that the focus will be on containment and second dose coverage.
Are people fearing a return to a lockdown and the loss of income that comes with that?
Well, concerns have definitely been spiked by the Omicron virus, but they are not reflecting on the streets as of now. India just went through a massive festive season. Markets continue to be crowded, and many people continue to travel, finally getting a break from the lockdowns that India did see earlier in the year. So while there are concerns, people are not reacting immediately, and anyway, scientists as well as doctors are watching closely, encouraging social distancing and masking and vaccinations, but the people so far may not be up to taking up those restrictions again.
And Nimisha, tell us what the vaccine uptake is like in India at the moment.
Well, Sumi, while 80% of the adult eligible population has received at least one dose, there are concerns about people coming back for the second dose, given that India has seen a serious fall in cases, under 10,000 cases every day right now. And this is coming down from a high in the second wave of over 400,000 cases. So there are concerns about that, which is also why the Indian Prime Minister reiterated that we must ensure that everybody has gotten their second dose as well. The vaccination drive spiked in September, coinciding with the Prime Minister's birthday, but it has significantly slowed down.
DW's Nimisha Jaiswal reporting there from Delhi. Thank you.
Joining me now from Johannesburg is Shabir Mahdi. He's a professor of vaccinology at the University of Witwatersrand. Mr. Mahdi, thanks for your time. Infections are increasing rapidly in South Africa at the moment. Is it because of Omicron?
Good day, thanks for having me. So yes, it is because of Omicron, and the main increase is in the Gauteng province, which is where the variant was first identified. The positivity rate, the number of people that are testing positive when tested, has increased from 2% 2 weeks ago to more than 20% in a period of 2 weeks. And the number of cases and the slope of increase of this particular trajectory is much steeper than what we experienced in the past. So Omicron is certainly dominating, making up more than 90% of all infections that are occurring, at least in Gauteng. But at the same time, what is important is that there seems to be an unhinging of the case rate in the community and hospitalization rate. In that, the hospitalization rate is much more subdued than what we would otherwise have expected based on the amount of infections that are taking place when we compare with what occurred during the course of the first 3 waves.
Right. There's also evidence to suggest people are being reinfected. That is, people who've already recovered from coronavirus catching this new strain. Is that true?
Absolutely. The number of reinfections are quite a bit, including in our longitudinal cohort studies, in addition to which the number of breakthrough infections in fully vaccinated individuals is also quite substantial. But again, most of those infections are mainly mild disease. We're seeing very few, if any, breakthrough cases in fully vaccinated individuals that are ending up in hospital. You did mention that there was an increase in hospitalization of children. We just need to be careful that all children that are admitted to our facilities are routinely screened for the virus, irrespective of whether they've been admitted for COVID or not. And most of the children that are testing positive are actually not being admitted for COVID. And this is a coincidental finding in children that are being admitted. At the time of the peak of the wave in South Africa, when we tested people at random, up to about 15 to 20% of people were testing positive for the virus when the wave was peaking. So it's not that children are more likely to be admitted for COVID. They're just testing positive for the virus.
Right. You mentioned vaccines there as well, but there's been some conflicting information on vaccines. Do you know yet if the current vaccines are effective against this variant?
So the lab test is currently underway, but I would be highly surprised given the number of mutations affecting the spike protein, and particularly that part of the spike protein against which the antibodies sort of are able to neutralize the activity of the virus. The number of mutations suggests that we would expect almost all of the vaccines to have significantly diminished activity against the virus. But on the other hand, vaccines also induce T-cell responses, which are particularly important when it comes to protecting against severe disease and death. So I expect lots of breakthrough infections to occur in fully vaccinated people, but those people will still be protected because of vaccination against severe disease, as we observed with the Beta variant and AstraZeneca vaccine as an example.
Okay, well, Shabir Mahdi, Professor of Vaccinology at the University of the Witwatersrand University in Johannesburg, thank you very much for your time.